Hello, everyone. My name is TJ Park. I'm a psychiatric nurse practitioner. Let's see, my degree, DMP, and PMH and This is a psychiatric mental health nurse practitioner. And this is the mental health workshop. Our topic today is on depression. We're going to talk about what it is, what the depression is, and its potential causes and treatment options. And we'll end the session with any questions or any discussion that we might have. Um, so yeah, our my talk will be about 20 minutes to 30 minutes, and then the rest of the session will be dedicated to any questions or discussion that there might be. And this video will be posted on the channel. So just letting everyone know. So yeah, let's get started. What is it? What is depression? It's a low mood, and also in DSM-5, our diagnostic statistics manual for the psychiatric providers to use to make diagnosis. It can also be irritability. When you think about depression, it can look very different from person to person, from different age group to age group, and in different culture to culture. When you think of teenage children, irritability can be a symptom of depression rather than low mood or looking depressed. And everyone gets depressed, right? It's a normal emotions or reactions to certain situations. For example, grieving, loss, um, trauma, or adjusting to new environment, or some challenges, life challenges. So, feeling low is very normal human emotions and feelings. However, it can be problematic when it starts to affect our functions, and it causes some distress in our life. That's when it call a lot of symptoms as disorder in psychiatric practice. And depression can range the spectrum, right? And there are different diagnoses too. Um, for example, there can be adjustment disorder with some depressed mood, and there can be also something called dysthymia. Um, we also call it persistent depressive disorder. Dysthymia is something. It's a condition where people don't really meet the full diagnostic criteria for major depressive disorder, but their like default is feeling low. They don't really feel happy, and typical question we ask is, when was your last time? When was the last time you felt happy? And some people have trouble answering that, because their default is always little bit sad or a little bit low, depressed, not to the again to the level or severity of a major depressive disorder. One thing uh, um, difficult about this dysthymia is that it can become more like their personality. It can become who they are. So people can just say, "Oh, just that's how he is." He's a quiet one. He doesn't have much emotion or whatever. Doesn't really get excited for anything. Doesn't really get happy for anything. Maybe not even really sad for anything. Just feeling really dull. And there is major depressive disorder. Um, so major depressive disorder is the one that is most talked about. Again, everyone becomes depressed, where everyone experiences low mood. But for people to have this disorder, that low mood or irritability has to last more than 2 weeks. That's the clinical timeline, and of course, it has to be more than just low mood. Uh, it has to be, for example, sleep, interest. Um, let's see, feeling guilt or hopelessness, low energy, um, concentration issues, appetite up and down, um, and psychomotor changes, and also suicide thoughts. So yeah, those 7 things can be other symptoms other than just feeling low or irritable. People can sleep too much or too little. People uh, don't feel really joy out of things that they used to enjoy. Their interest rate goes down and they become more isolative. Sometimes they experience uh, feeling guilty, where they feel like they don't really deserve to be alive or deserve to be loved or belonged, feeling hopeless and helpless, and low energy, and concentration can be decreased. And appetite is like sleep; it can go up or down. Eating too much or eating not much, so they lose weight. And psychomotor changes. Some people uh, become really slow in their speech or in their movement, motor skills. They just kind of move slow all of a sudden, or talk very slowly because their energy is low. They're depressed, and people can feel suicidal. Or they feel like their life is not really worth living anymore, and then they actually think about ending their life or killing themselves. So that's what we call major depressive disorder. Let's talk about some potential causes. What could be some causes of depression? I think we can look into two possibilities: endogenous and the exogenous. Let's see if I can spell it. Exogenous. In other words, nature versus nurture, or genetic versus environment. So those two categories can be, we can differentiate those two causes maybe of depression. So endogenous or nature or genetic. Some people can become depressed just overnight. They were feeling fine night before, and their life hasn't really changed at all. And then they wake up next morning and feel depressed because it's just endogenous neurochemical issue in their brain. And it can run in the family as well. Just like some families are taller than others, shorter than others. People can have depression genes that can cause some depression as we live our life, more prone to become depressed. And probably most of the causes of depression can be explained by exogenous reasons or environmental or nurture part. Um, so if something happens outside of our brain chemistry, it can be like accident, like brain trauma, brain injury. I used to work with a patient. I had this one patient who had a car accident and had a brain injury, and it damaged part of his brain where is associated with mood regulation. So he had really treatment-resistant depression from the brain injury and trauma. or abuse. Um, when people experience difficult challenges or situations or abuse in their life, it's hard to feel loved, hard to feel worthy or valued. And that is going to affect our self-esteem, self-image, and it can change uh, the brain pathway or brain structure. Actually, trauma can uh, not literally but figuratively bruise our brain. Verbal, emotional, sexual trauma can bruise our brain, part of the brain, so people become more numb or more prone to depressed. And um, the psychiatric conditions is about brain connections, the pathways, brain pathways. There are neurons in our brain, um, neuron synapses, synapses. There are millions, billions of neuron synapses that talk to each other, that connect to each part of our brain, and they use these neurotransmitters. They are the messengers between this neural synapses, between the presynapses and the postsynapses to relay the message. And uh, it can be disrupted for many different reasons. Like I mentioned, the genetic can be part of it, or nurture or environmental can be part of it. It can be injured, or there can be trauma or abuse. And it's just like using the muscle too. When we tend to think of only negative stuff, we are going to strengthen that brain connection that uses the negative thinking pattern. And we'll talk about in treatment options, but to change that brain pathway, it takes a lot of work. We have a lot of automated thinking patterns that can be negative or not too helpful. And with the help of professionals, many times we can change that thinking pattern into more positive and more sustainable. And when we use that thinking pattern more, it it can activate, it can nurture the part of the brain that helps us feel happier. Um, any other exogenous reasons? Let's see my notes if there's anything. Um, and it can be cultural and social too. Some cultures or some countries have much higher depression or suicide rate than other society. I am from South Korea. I was born and raised there, and South Korea has number one suicide rate in the world. Um, Although we've achieved this tremendous financial, economical success, maybe there was a part that we overlooked while we strive for this success materially. Um, and like I said, culturally and socially, a lot of scholars are trying to figure out why Koreans commit suicide so much. And we have this culture, maybe what maybe potential reason is that we compare ourselves to others constantly. We are just taught to measure our success um, not objectively. Our happiness is all measured objectively. Are you on the top of your class? Which school are you going to? What grade did you get in that class? How much money you're making? What is your title? Uh, that's how we actually decide how happy we're going to be. Um, because that has been our focus so much. But I think we are learning over the years that it's not really sustainable, healthy for us, and there's more than just numbers and material success. And yeah, there are some other countries that are so much happier, uh, even though they are not maybe not as successful economically. So I think culturally and social context can really play a role there as well. Mm, and we talked about neurotransmitters here a little bit as potential causes, and they can go underneath the endogenous part there. Let's see, neurotransmitters, and there are about three neurotransmitters that we want to talk about today: serotonin, norepinephrine, and dopamine. Very simplistically speaking, serotonin is happiness neurotransmitter. Norepinephrine, maybe we can say vitality, energy or vitality, and dopamine, pleasure. Um, and we theorize that people who are depressed, there is neurochemical imbalance in our brain. So we have some ways to correct this imbalance in our brain. Let's look at our treatment options then. Um, the treatment options we can maybe there are three treatment options we can say. First one is psychotherapy. Second one is pharmacotherapy, and the third one is neuromodulation. First one, psychotherapy. Many people probably have heard about it. There are many different forms of uh, psychotherapy, or different schools. Maybe one of the most famous one is CBT, cognitive behavior therapy, and there are many therapy modalities. They use this emotions, and um, they're like Adlerian and psychodynamic, emotionally focused therapy, and internal family system therapy. There are so many of them. Um, and they all offer different benefits and different perspectives. And I think that's the core um, idea about psychotherapy, perspective change. We to a certain degree, we always have choice of we always have a choice whether we are going to be happy with what we have or be miserable with what we don't have. Um, um, People want to get a job or something, um, and they can, they let's say they got the job and they can be happy with the job they got, or they can still be unhappy with the job they get because there are other jobs that looks better or that are better, better salary, better benefits or whatever, or that I didn't get the other one, um, instead of trying to be happy with what they have. And so sometimes it's hard to look at it that way many times, because again we have this automated thought patterns and systems that we are used to. Um, but with the help of the therapist, we can change that thought pattern and really promote and change the brain pathway and the structure in the long term. And good psychotherapy can be as effective as medications. And the pharmacotherapy, that's prescriptions, medications. Maybe we can talk about some different classes: SSRS, SNRIs, NDRIs, the SMSs, and there are many other ones too. Like I mentioned earlier, we focus on those neurotransmitters here. And first one is selective serotonin reuptake inhibitors. We talked about synapses, the presynaptic nerve, and the postsynaptic neuron, neurons, and they have to communicate well for us to feel better and function well. Um, but as I mentioned, we theorize that people have depression, that they have dysfunctioning neurons or communications between them because of a lack of or dysfunction of neurotransmitters, for example, serotonin. So selective serotonin reuptake inhibitors, they block the reuptake receptors on the presynaptic neuron, so serotonin becomes more available. Um, there are about six medications in the SSRIs. They are all equal, but not the same. Um, so which ones to pick depending on your provider's preference and also your symptoms. Some of them are better at certain things and not so better at certain things, and some of them have certain side effects that actually might work better in some cases. For example, some SSRI can make people sleepy, but some people may need more sleep because they have not been sleeping well when they're depressed. Um, and as NRIs, it's a selective serotonin norepinephrine reuptake inhibitors. So theoretically, two neurotransmitters. I can think of maybe uh, two, two, three, maybe three popular ones, about three popular medications in this case. Um, Again, they are all equal but not the same. They have different strengths and weaknesses. So it's something you should discuss with your provider if you do decide to use the medication. And NDRI, it works on dopamine and norepinephrine reuptake inhibitors. I can think of one medication called bupropion, really good depression medication. Um, may not be best anxiety medication. It's not FDA approved for anxiety, but I've seen many patients benefit in anxiety as well. Um, let's see. And SMSs, they are newer antidepressant medication. For example, vilazodone or vortioxetine. They also work on serotonin receptor. I believe it's called serotonin multimodal stimulators. Uh, Not only blocking the reuptake units or receptors, they help to promote serotonin balance in our brain system. And there are many other ones like mirtazapine, trazodone, mm, and there's only also another medication brand name called Auvelity. Auvelity is a combination medication with the bupropion, which I talked about here, NDRI, with the cough medication. So it's a different mechanism of action. Um, let's see. Um, so yeah, I typically think of medication as something like a life tube, lifeboat, or floating tube. When somebody's struggling in the water, uh, they need something to float with, and that can be medication. However, they still gotta learn how to swim, which can be therapy. So, with the help of medication floating, and you learn how to swim in your therapy sessions, how to manage your anxiety or stress or depression, changing your perspectives in your life. That's combination of medication treatment and therapy treatment. That has the best outcome for the recovery of depression. Um, Lastly, there is option of neuromodulation. Um, so we stimulate or manipulate our brain itself. Some examples: ECT, EMS, and ketamine treatment. So ECT, electric convulsive treatment. Convulsion is seizure. Many people maybe have seen it or heard of ECT treatment, maybe in movies, in asylums, back in uh, long time ago, and depicted very horrible as a horrible treatment. But nowadays, it's like operation. It's done in a uh, not to the level of OR, but people go under general anesthesia and they are given medications to relax their muscles, so they are not seizing as hard with their body parts. So basically, we introduce or induce electricity, give a little shock to our brain to induce seizure activity in our brain. And um, we don't really fully understand how it treats depression or how it treats many psychiatric conditions, but one theory is that it promotes healing in our brain. It kind of resets, reboots the brain cells so it can restore its balance again. And TMS, let me think. Trans. Yeah, I'm blanking on the T part. TMS. A transcranial magnetic stimulation treatment. So transcranial brain, your head, magnetic stimulation. So it's not as invasive as ECT. You go to this treatment center, TMS treatment center. Literally, you sit in a chair like a dentist office, and then they have this machine that shoots out magnetic stimulation. It's not painful, um, very safe, and very effective as well. They stimulate or shoots this magnetic stimulation into a part of a brain that's in charge of that's associated with depression. Um, I have worked with many patients who had this TMS treatment. Of course, while they are on medication, they can stay on their medication, and they surprised themselves. They were surprised how effective it was. And the ketamine treatment, ketamine is a anesthesia, I believe, but we found that it really lifts people out of this severe depression. Um, People felt better. So, with these pharmaceutical companies and researchers came up with this, ideal dose to treat depression with this ketamine, and they made into nasal spray. Before, I think it was only through the IV, which was more invasive. But now, as ketamine came out, is the nasal spray, but still you need to go to the treatment center and get monitored because your blood pressure, things like that, can change with the ketamine in your system. But it can be very effective treatment as well. Um, so those three things: psychotherapy, pharmacotherapy, and neuromodulation. are three fundamental treatment options for depression. Yeah, thank you for listening, and I hope you learned something new. And feel free to ask any questions, and we will have discussion and answers.